Welcome to this clinical walkthrough on the Herpetic Whitlow case for UKMLA, brought to you by Mediae, your 24/7 practice partner.
All right, let's jump right in. Your patient is a typist, and this is what he opens with. This sentence is your cue to begin the consultation, starting with a really focused history.
So your first move is to quickly confirm his details, and then you're going to dive right into the history of what's brought him in today. The question is, what exactly do you need to ask? These initial questions are all about understanding the lesion itself. You want to know its timeline, its symptoms, and this is a big one, any of those classic viral warning signs like a tingling or burning feeling. Asking if it's happened before is also super important because that can point you towards something recurrent like HSV.
Next, you need to screen for a viral cause. The link to cold sores is a massive clue for Herpetic Whitlow, so you have to ask about it directly. And, of course, you'll ask about any systemic symptoms to make sure you're not missing a more widespread infection.
After that, you'll do a quick background check. A good framework like PMA, FTOS, past medical history, meds, allergies, and so on is your best friend here. In this case, the absolute key finding is his history of recurrent oral HSV. And also, take note of his occupation. It's being directly affected. Using a structure like this, make sure you don't miss a thing. Never, ever forget it to explore the patient's ideas, concerns, and expectations. This isn't just about building rapport. It tells you exactly what you need to cover in your management plan. You can see right here, he's worried about it getting worse and wants a clear diagnosis and a quick treatment.
And finally, always ask how this is messing with their day-to-day life. For this patient, it's hurting his job and he's worried about passing it on. This info is going to be gold when you discuss work and hygiene advice later. So, once you've got that solid history, it's time to smoothly transition to the physical exam. This is where you'll find the clinical signs to lock in your diagnosis. Use a simple, polite phrase just like this one to get consent. It's a small thing, but it clearly marks the shift in the consultation and shows respect. During the exam, you are hunting for specific signs, and you need to say what you find out loud. A single, clear, fluid-filled blister with no pus, combined with that healing cold sore on his lip, that's pointing you straight towards a viral cause. And noting the absence of swollen glands is just as important. When you give the diagnosis, use simple language, no jargon. Linking it to something the patient already gets, like cold sores, makes it so much easier for them to understand and accept what's going on. Then you can follow up with a clear definition. Explain what it is, what causes it, and, super important, that it's contagious. This directly hits on his earlier concern about it spreading. Okay, diagnosis is sorted. The next step is all about building a clear, actionable management plan. This is where you deliver on the patient's expectations. Always start by explaining why you're recommending a treatment. A phrase like this one is perfect. It connects the timing with the benefits of the medication. It shows them your logic. Break the plan down into easy steps. 1, 2, 3, 4. It's much simpler for the patient to remember. You've got the antiviral, some pain relief, and then the crucial advice on dressing and hygiene to stop it from spreading. And hey, a quick thought for your own preparation. The best way to master these consultations is repetition. You can practice this exact case right now, get objective feedback on mymediate.com. Managing expectations is a huge part of this. You've got to give them a realistic healing time. Let them know it'll likely clear up in about 2 weeks, maybe after scabbing over. This stops them from panicking when it's not gone overnight. We're on the home stretch now. The final part of the consultation covers 2 absolutely critical areas: practical advice about their life and solid safety netting to keep them safe. Remember, he's a typist? This is where that comes back into play. You have to discuss work, but don't just tell him what to do. Give him clear options. Let him be part of the decision. He can either take time off or you can help him manage at work. This empowers him to choose what's best. And whichever option he goes for, this part is non-negotiable. You have to hammer this point home. The blister must be kept covered and clean. This is to stop it spreading to other people or even other parts of his own body, like his eyes. Your safety netting advice needs to be specific, no vague instructions. Give them a clear list of red flags for a secondary bacterial infection. Tell them if they see pus, spreading redness, or start to feel sick, they need to come back immediately. To wrap things up, just clarify the follow-up plan. For a straightforward case like this, no routine appointment is necessary. And offering an information leaflet is always good practice to help reinforce everything you've said. And that is our walkthrough of the Herpetic Whitlow station. If you follow these structured steps, you can manage these cases with total confidence. To put it all together, you can practice this exact case now on mymediate.com.